Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hi, welcome back to the Pharmacy Leaders Podcast. My name is Samantha Dao. I'm a P4 student at Drake University in Des Moines, Iowa. I have a very special guest here today. Her name is Dr. Eliza Dy-Boarman. She is an assistant professor of pharmacy practice, also at Drake University. Dr. Dy-Boarman received her Doctor of Pharmacy degree from Butler University in 2011, and she completed a 24-month pharmacotherapy residency co-funded by Butler University and Indiana University Health in Indianapolis, Indiana. Her current practice site is at Iowa Lutheran Hospital in Des Moines, where she serves as an internal medicine clinical specialist. She teaches in a lab-based skills course series, precepts and acute care APPE, and coordinates the second-year IPPEs. Her research interests focus on the scholarship of teaching and learning. So thank you very much for joining me, Dr. Dy-Boarman.
Yeah, thanks for having me.
Yeah. So obviously, you're a faculty member at Drake University, and you have a clear interest in teaching and learning. So let's start off with the first question. How did you first get interested in academia?
Yeah, I didn't always know that I wanted to be a faculty member. It was during my APPE year that I really started to develop an interest in it and started to pursue or look into it more. So I had a faculty mentor. He was one of my professors early in pharmacy school. I had him a few times in our therapeutics recitation courses. He taught a few therapeutics lectures, and I really looked up to him. He was one of my favorite professors. He not only was very knowledgeable and a great teacher, but he really got to know us as students. And so I preferenced him for rotations and was lucky enough to have him early in my APPE year. And so it was really interesting and eye-opening to me to see him then in the practice side of things. I'd always known him just as a professor. To see him, work in internal medicine in the hospital, be a really great clinical pharmacist, and also, again, a really great preceptor. And so we developed definitely kind of a mentor-mentee relationship through that process. And just in conversation with him and learning more about his job, being a clinical faculty member, it really sparked an interest in that field. And so I asked a lot of questions about his job and how he ended up being a faculty member. And I think he also saw in me some skills and some strengths that I didn't realize I had that matched closely with being a faculty member. And so that's kind of, like I said, how I came up with that idea. And I think he really developed me. And so I owe a lot of that to him.
That's great. Yeah. So in my experience too, I think that as a student, a lot of my peers either have a really good idea of what they want to do as students, or they really have no idea. So in that sense, that's why the APPE or rotation year is so great, because you get to have so many new experiences and then you discover what you're passionate about.
Yeah.
So I think that's great.
I agree. Yeah. Like I said, I never would have told, if you'd asked me early in pharmacy school if I would be a faculty member at a pharmacy school, I would have said absolutely not. That is not for me. But like I said, I think it took me understanding more about the position and also him identifying in me some things that I didn't even know about myself.
Yeah, that's great. And then I also think, you find that one faculty member, that, mentor that you can look up to, and then you tend to kind of follow in their footsteps.
Absolutely, yeah.
It's great that you found something that works for you and is a good fit for you.
Yeah.
Okay. So going along with that, what kind of path did you have to follow to get to your current position as a faculty member, specifically at Drake University?
Yeah. So like I said, once I identified, hey, I'm kind of interested in this, I knew that I wanted to pursue a residency program, but then it really encouraged me to pursue a program that had strong ties to an academic setting. So I really looked for residencies that had close affiliations with a college of pharmacy, and that would allow me to practice or to get a sense of, is this right for me? Is this the right career path? And so that's really how I landed, as you mentioned, I landed up landed the position with Butler University and IU Health. And so it was really cool being co-funded by the two institutions. I had all of the clinical training that I wanted to get out of a residency from IU Health, but then I also had that strong emphasis in academia through Butler. And in doing so, again, it just reinforced that strong interest that I had in teaching and working with students, and really developed me as a faculty member.
That's awesome. And they're always telling us as students that networking is so important. You know, pharmacy is a really small world once you get out there. And so it's great that you had that connection to Butler already.
Yes.
It really opened doors, didn't it?
Yeah, it really did.
Great. Okay, so speaking of that residency, you did for 2 years. And so as a preceptor within that residency, what was your role in teaching students during those PGY1, PGY2 years?
Yeah. I think typical of most residencies, I had a lot of interaction with students on most of my rotations. So being in Indianapolis, there were a lot of Butler University and Purdue University students on rotation at IU Health at any given point in time. And so just generally, like I said, I had a lot of interaction and got to observe my preceptors precepting APPE students. So I learned a lot just from that alone. But being co-funded really opened a lot of other doors for me. So from an experiential standpoint, during my PGY1 year, I was the primary preceptor for one APPE student. And so I really got to develop my own syllabus and my own calendar and the types of rotation activities I wanted my student to do, and just practice, how do I help develop and mentor this student during the course of this rotation block? And so that alone was a huge, again, eye-opening experience. It was frustrating at times, but really rewarding to be able to work through that and develop that, of course, under the guidance of my residency program director. So I had that experience during my first year. In my PGY2 year, then it got ramped up. I was the primary preceptor for 2 students during one rotation block. And so then again, I'm learning now, not only how do I structure my rotation for one student, but how do I tailor that to 2 students with 2 different skill sets and interests and goals. And so again, that really helped to develop me as a preceptor. In the didactic setting, being co-funded again, I was able to do a lot of teaching on campus. And so all 4 semesters of my residency, I led what they called case conference, it's a recitation that was tied to their therapeutics course. So each week I led 15 students and we discussed some type of case related to what they were learning about in therapeutics. So I got to know them really well. We had a lot of discussion over the 2-hour time frame every week. So that was a really neat opportunity in a kind of a more intimate setting. And then I also delivered a few lectures. So I taught in some of the bigger didactic classes and then in one of the smaller electives that had about 20 or 25 students. So I had a lot of variety. And I would say too, the other thing is being able to do a 2-year residency like that. I was able to deliver lectures during the first year and then kind of reflect, refine things, make changes, and then actually implement those changes during the second year. So I saw a lot of growth in myself that I think helped develop me into a faculty member.
Yeah, that's really fascinating and interesting how you were able to take the time to reflect on your own developing skills and how to best implement how you wanted to teach and, developing your own style. I think it's a really interesting and it's a time for you to reflect on yourself as well. And I'm slowly finding that as I am right now completing a non-patient care academic rotation. Having a mentor to look up to and see how they teach, but then finding your own style as well.
Absolutely.
Yeah.
And that takes time. It doesn't happen immediately. And like I said, that was perhaps one of the frustrating things for me. I just expected to be a good preceptor on day one, and it doesn't happen that way. It takes some time and reflection and some work, just trying it over and over.
Sure. And so you mentioned that academics really wasn't even on your radar until your APPE year. So, once you discovered, hey, I'm kind of interested in this, were you just all in, or were there some aspects of it that you kind of had to convince yourself, okay, I think I can see this working out?
Yeah, I probably went through different phases. I think I was all in at the beginning of residency. Like I said, when I hit some of those more frustrating parts, you have those you always have thoughts, is this right for me? Oh my gosh, this is way more difficult and way more challenging than I ever thought it would be. Maybe this isn't the right path. But luckily I had, again, really good mentors who said, hey, I've been there. It is hard. This is challenging and you can do this. And I know it's frustrating, but let's work through this and let's talk through what's frustrating about this or what didn't go as planned. And like I said, I think one of the best things for me in building my confidence and, solidifying, yes, I can be a good preceptor and a good professor and a good faculty member, I think was having the opportunity to see my own growth, to try it again in the second year and say, wow, that went so much better. And all those ideas and changes that I made, they really worked and students are getting something out of this. And so, like I said, it was kind of a roller coaster. So I had varying levels of being in and out, but again, always had that passion and really enjoyed working with students, regardless of whether or not things were difficult. It was always fun to work with students.
Yeah, great. And so now you as a mentor can then turn around and kind of help current pharmacy students with their successes and their struggles as well.
Absolutely.
So after this podcast is done, I might have to ask you for some advice.
Always.
How to go about this academic rotation I'm doing. Okay, so obviously you have a lot of credentials to your name. You're also involved with the American Association of Colleges of Pharmacy, or AACP, and also the American College of Clinical Pharmacy, or ACCP. So can you tell me a little bit how these organizations support your role as a pharmacist now?
Yeah. So I think I'll start with some of the similarities. I think, both AACP and ACCP serve to provide education to pharmacists in their different respective roles, networking with others who kind of share similarities in your practice or in your teaching, and also, just opportunities for leadership and engagement. And so I think for both of them, I've seen the benefits of being involved in the organizations. Specifically AACP is an organization for pharmacy faculty members. And so one really great thing that I've gained from that is just the networking piece of that, meeting other faculty members from other schools of pharmacy across the nation, collaborating with them on research projects or, some type of initiative to support students or faculty. And so I think that organization has really helped to develop me as a professor and as a faculty member. And then ACCP is, of course, the organization more for clinical pharmacists. And so that's been fun for me to interact with other individuals, other pharmacists who aren't necessarily faculty members. They are practicing clinical pharmacists. They may or may not be preceptors. And so just kind of building again that strong network of individuals who also share my practice interests. I practice in internal medicine or adult medicine, and so being able to collaborate on things related to that. So it's kind of those two organizations represent kind of the two main aspects, I think, of my position and my interests. So.
Yeah, that's great. So again, that idea of networking and its importance comes up again.
Absolutely.
Both of us being affiliated with Drake University, it is a well-known pharmacy program in Iowa and in the Midwest in general. But having that opportunity to interact with other pharmacists nationwide. And then, as you said, there are many facets, in the field of pharmacy. So to be able to collaborate with people in your specific field, that's really great.
Absolutely.
And I think that's a great piece of advice for student pharmacists to find out what they're interested in and make those connections.
Absolutely.
Yeah. Okay, so as a faculty member, as a mentor, you do take on advisees at Drake. So full disclaimer, I am an advisee of Dr. Dy-Boarman. So I'd like to ask you, how do you approach your individual advisees any differently from lecturing in front of large groups of students?
Well, I'd like to think that hopefully I approach you guys in the same way. It's an interesting question. I think when I consider the things that are important to me about my teaching and the things that are important to me about being an advisor or a mentor, I want to approach both situations with positivity and enthusiasm, with clarity. I want to challenge, both my students in the classroom setting and my advisees to think independently. And so hopefully you would agree that those things are true in both settings, because like I said, that's what's important to me as an educator. And so really when I look at it, hopefully, I'm kind of emulating some of the faculty members that I had. Some of the best professors that I had were the ones who, when they were lecturing, it almost felt like they were just talking to you. And so that's kind of how I approach teaching. So I guess to answer your question, probably only in content maybe is the way I see the biggest difference between my lecturing and my conversations with advisees.
Yeah, great. Okay, so moving along with your role as an advisor, as I mentioned, you come to form relationships with students over either 4 years or 6 years, depending if they start out with the pre-pharmacy program here at Drake. So what kind of change have you observed in your advisees over that time period? And I am genuinely invested in this next answer here.
Well, I would say, and I hope you agree with this statement, I think the two biggest ways are in maturity and in confidence. Most of my advisees that I get initially as pre-pharmacy students are 18 years old. They've just graduated high school. And in many ways, this is kind of their first time being on their own, whether that's living on their own or just making their own educational choices and decisions about how they're going to approach their day-to-day life. And so I think there's a lot of growth that happens in that 4 to 6 years. I think along with that growth and along with, overcoming challenges, the types of challenges you have in college, and making big decisions about courses and degree concentrations and minors and activities, I think along with that grows a lot of confidence as well. And so I tend to see year by year, like I said, not only maturity, but just that confidence and that self-assurance start to build in my advisees. And so it's really cool when I get to see someone like you who I've known now for, going on 6 years, to see how much you've grown in that regard. And I always try to mention to my pre-pharmacy students, especially when they're going through some type of challenge, whether it's an exam that they didn't perform very well on, or maybe it's something more personal in nature, to reflect on that and then remember those moments when they're at the end of their degree program, because reflecting on that and thinking about all the growth that's happened is a really neat opportunity for you guys to say, wow, look at all that I've accomplished and all that I've overcome in the past 4 to 6 years.
Yeah, great. And hearing that answer, to me, it really reiterates the point and the importance of continuing education. Mm-hmm. So already we've talked about how, your involvement in certain organizations has given you the opportunity to continue learning, continue your own education, even as a faculty member at a college of pharmacy. We discussed you reflecting on yourself and your development of new skills during your pharmacotherapy residency. And now, at the youngest level, perhaps, us as pharmacy students, how we're able to grow and develop during those very developmental years as a student. So, very important. Yes. To continue your education. And, it is ongoing. So
Absolutely.
There's always room to grow and develop, isn't there?
Definitely. Over the course of your career, yes.
Okay, I did notice that during your thought process, you did not once mention the word pharmacy when referring to us as students. And I really appreciate that. And I think, with me and other students, you are always very open about letting us know that our entire lives don't have to revolve around pharmacy, especially once that we graduate. So why did you believe that this is important to tell students?
Yeah, I think it's an interesting question. It's made me kind of reflect on this. I think really it has to do with my own experiences. I loved pharmacy school. I had great pharmacy colleagues. I was involved in pharmacy organizations, but I was also involved in other things that were not pharmacy related. I was active in a social sorority. I was on my college dance team. I went to lots of Butler basketball games. And in reflecting on my college experience, those are some of the best memories that I have about pharmacy school. And so I want my advisees and my students to have those experiences too. I don't want you guys to ever miss out on something because you feel like you have to be solely focused on just pharmacy related things. And I know that, most of my students have other interests. And so I think it's so important to pursue those and to continue to enjoy those different hobbies and things. And I think outside of that, pharmacy can be a really demanding job. It's a very important job and one that I'm very proud to say I'm a pharmacist. But again, it can be very consuming. And so you have to have some type of outlet. At the end of the day, what is it that you can go home to continue to find that work-life balance? Like I said, I'm proud to be a pharmacist and to be an educator, but I'm also a wife and a mom and a Christian and a dog lover and a CrossFit athlete and an amateur cupcake baker and all these other things that I enjoy doing. And so I think that's one of the lessons I want you guys to learn as students is how do you find that balance so that you don't get burnt out and that you don't someday say, enough is enough, I'm done with pharmacy. But to be able to enjoy both your professional and your personal life beyond graduation.
Yeah, and as you said, pharmacy is a very demanding profession and the coursework is very rigorous for students. And of course, we're all very passionate about becoming future healthcare providers. We want to provide the best care for our patient. But when we talk to other peers who are non-pharmacy students, they always say, the first thing they say is, wow, you're in pharmacy, you must have no time for anything else. And so it is refreshing and comforting to have someone kind of let us know, hey, it's great that you're working hard and putting your best effort towards pharmacy school, but it's okay to pursue other things. We as students really appreciate that, so thank you. Yeah. And I think my experience reflects your own in many ways. I was also involved in other multicultural organizations on campus. Diversity is something that is very important to me personally. And I think the key is that these other experiences are not mutually exclusive to pharmacy. I found ways to include my other activities and the experiences that I've gained through those and apply them to pharmacy. And so I would like to point out, as a school, Drake supports various initiatives to increase diversity on campus. So I'd like to ask your opinion. Why do you think it's important for us to be exposed to diverse populations as students while we're still in school?
Yeah, I think, that really is just the reality of practice. I think you as a pharmacist following graduation are going to encounter all types of diversity. And, we tend to think about diversity only in regards to race or ethnicity. But there is all types of diversity that you're going to encounter. You're going to encounter socioeconomic diversity, age diversity, religious diversity, even diversity in the types of health beliefs that people have. And so I think exposing you guys to that early and getting you comfortable with learning about someone who's different than you, who has a different background and a different understanding of medications and healthcare, is so important to train you to be an effective pharmacist in any setting that you find yourself in after graduation.
That's awesome. And I've certainly come to the same conclusions about diversity and working with diverse patient populations. And so I'm very interested in that. And hopefully I get more and more experience as I continue through the rotation year.
Absolutely.
And after graduation as well. So speaking of after graduation, what types of opportunities have you found exist for pharmacists to continue to learn about diversity?
Yeah, I think just even in your day-to-day practice, I think it's important to identify maybe your gaps in knowledge about certain types of patients. Like I said, there's all different types of diversity. And so just being open and aware of those I think is kind of the first step. I think the other piece of it is, we oftentimes think about learning about different cultures by going on different mission trips or going abroad. And I think those opportunities are great. And if those opportunities come up, absolutely, if that's your passion, I think you should pursue those. But we forget that there's diversity even within our own community, and there are lots of opportunities to learn about different cultures or different backgrounds by, volunteering at free clinics in the area or volunteering at different health fairs. And so being aware of those opportunities and taking part in those, I think, is really important to continue to develop after you graduate. And then there's all types of resources. I know there are CE opportunities that you can pursue. I know that at my practice site, they use a database, an online resource. And so let's say if a patient does come from some type of different ethnicity or cultural background, we can learn more about, okay, what are generally their health beliefs, to get a better understanding of that. And so, like I said, there's all types of resources that you can utilize in order to learn more after you graduate.
Yeah, so what I'm hearing you say is that there's a lot of opportunities that exist. They can be as large scale as going abroad, seeing other countries, or as small scale as interacting with an individual patient, getting to know them and their background, and how to best fit their needs.
Yes, absolutely.
Right? Great. So you mentioned, encountering patients in your day-to-day work. Could you tell me more specifically how diversity has impacted you at your practice side? Or maybe do you have a story that really sticks out in your mind that you remember?
Yeah. So as you mentioned, I practice in internal medicine at Iowa Lutheran Hospital on the east side of Des Moines. And we see a pretty diverse patient population, like I said, in all aspects of diversity. And so I have been really challenged on a day-to-day basis just to become more aware of that diversity and not making assumptions about particular patients, really getting to know, again, what are their beliefs on medications? What's their background? What's their understanding? What's their health literacy even? And so I think that's kind of the first piece of it for me on a day-to-day basis. I try to approach each patient, as an individual. And then I think the other piece of it as the pharmacist on my inpatient team is, yes, I have all this knowledge about, okay, here's what the guidelines say about this type of disease state or this medication, or here's what the best practice is. But maybe in reality, that's not the best for this particular patient for some type of reason. And so it's taught me how to be more adaptable and also to get more creative about, finding a resolution, treating that patient to the best of our ability, but also incorporating all of those pieces of, cost and beliefs about medications and all those other factors that are really important to patients. And so I don't know that I have a story off the top of my head, but like I said, it's something that I encounter kind of on a day-to-day basis.
Yeah, and as the profession continues to move back towards a patient-centered approach, I'm really hearing that you consider the specific needs of the patient, and it's a back and forth conversation with the patient. It's not just, this is what the guidelines say, this is what they say is supposed to be best for you, so we're going to go with that route. You really work with the patient to say, is this going to work for you? What is actually going to be doable and, going to allow you to accomplish your health goals through this drug therapy. So I think that's great.
Yeah, absolutely.
Okay, well, what other points did you want to make at all before we end the podcast here?
I don't know. I think we've covered the majority of them. I think, kind of the overarching theme, like you said, is just to continue to, I always encourage students to continue to push yourself and we always view graduation as kind of the finish line, but that's just the beginning of the journey ahead. And so just making sure, like I said, that you and all of your classmates continue to pursue goals and pursue interests following graduation.
Okay, well, thank you very much for your insight. I do appreciate you being on the podcast. So thank you, Dr. Eliza Dy-Boarman. Thank you for listening to the Pharmacy Leaders Podcast. We'll see you next time.
Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders. Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook.